Yeah, and I'll be back. Oh, yeah.
Even though our finance, it came from that stream of federal funding to the public.
Yeah.
So, all aspects of high-speed rail, that is the one that I was.
No, that one where you.
It doesn't, it's not a
Yeah.
particular whole
Yeah, I know.
But this
You know,
is
I think we've like 6 years. Yeah.
I just
So, long story short, we got all of our funding, but our deliverables, which we know we're doing.
So we have, we're actually gonna find out what our projects are gonna be. So I'm deciding on what those projects are. Jump on board one of the larger projects. Yeah, I would love to.
Yeah, I'll.
Great.
All right, welcome for our second session for 11. I'm really happy today to introduce Angelo Bellomo, who's here from LA County Department of Public Health, where he's Deputy Director of for Health Protection. He was a Director of Environmental Health Division. Angelo's been working for 45 years in different aspects of environmental health. We met many years ago at the LACDPH program, where he was an instructor for the hazardous waste worker training. He's worked in private industry. You probably wouldn't say this, but I would say you were the savior for LA Unified in a very difficult time with the Belmont High School complex and some environmental hazards, plus a number of other things that came up. He's guided at the county, he's guided the Environmental Health Division, dealing with all kinds of different environmental health issues, ranging from the more traditional food, restaurant inspection, hazardous materials, to new issues that we're facing, water scarcity, water security, the effects of climate change, adaptation to climate change, and he's going to talk today about these emerging environmental health issues that we're facing in the country.
Great. Well, thank you very much. Yeah, I do. It's hard to believe that I've been working in the field for 45 years. It just goes that quick. I remember my first day on the job, there was a guy who was retiring after being there for 30 years, an old guy, really old. And I remember him telling me, one of these days, kid, you're gonna turn around and you're gonna be an old man. And it happened that quickly. So. But it's been an exciting career. Environmental health is it's wonderful. And you all are working in the best program in the nation for this type of work from my perspective. And we're in California. In LA County, for example, right now, the conditions are very good for us to really make some progress because we have a relatively progressive board of supervisors, and that's always important. So we've got problems, some of which that I'm going to be talking about today are rediscoveries of problems that were discovered about 35 years ago, and you'll see what I mean. But sometimes a generation sort of gets tired of hearing about things and not really seeing any progress, and a new generation appears on the scene and is wondering, why aren't we doing anything about this or that? And I think one of the lessons I've learned, and I learned this a long time ago, was that things don't change, reforms are not implemented because well-intentioned government individuals come to work and implement those reforms. They get implemented because there is a groundswell of support from the public. It's picked up by their elected representatives. They now have an issue to sound off on, and they utilize that. And then things that the government might have wanted to implement, or individuals in the government might have wanted to implement, suddenly become much easier to do. And so it's really looking for these alignment of different interests. It's really looking for those alignment of different interests that we have to be conscious of. And that's how we get things done. That's how we reform the field. Now, this field that we happen to be operating under, and I'm talking really about environmental health as it's practiced in LA County, a local health department. It's expanded. The scope of what we do is expanding enormously. Now, there's been a lot of resistance for that expansion because it sort of went along. It sort of perfected or got as close to perfection in some of the areas as it could. LA County had some of the model programs in the nation when it dealt with air, certainly the Air Quality Management District, or what was the APCD. We were leaders in the area. And in water supply, in cross-connection controls, in food safety, we were doing very well, and I think we were a good model for other jurisdictions in California, and in some cases the nation. But there was a time where the program sort of slowed down a little bit, and it got comfortable with where it was at, and it was riding on its prior reputation. And before you know it, things advance to a point where you're no longer leading anymore, and it becomes necessary to sort of rethink where we're at and how do we now advance the how do we advance the agenda again, given the concerns. So I'm in an organization that made some real progress when I first joined it. It was on top of a lot of things. I was there for 10 years, and then I went away to the state, and then ultimately to the private sector, and then I came back to the county about 9 years ago. And it wasn't the county I left. We had lost an edge in a lot of different areas. And we're really excited because we've had the opportunity to try to claim some new territory, but it's all been centered on identifying the field of environmental health that goes beyond what our current practice is, and finding out where we can expand that current practice to get a little bit closer to what the true field of environmental health is. So I look at it this wide. Our practice was here, and we're slowly trying to pick selectively those things that we can do. And we've made partners along the way. I just can't say enough about Brian and about Mike, Dr. Jarrett, for all the help that they've been to the county health department. We've done a lot of great things together, and I'm hoping we're going to do more in the future. But it takes that. And as you'll see in probably the last part of my slides, I'm going to be talking a little bit about our partnership now with communities, because the stars are aligning. We have to look for those alignments. And when we can get the right grouping of partners together, there's no limit to what we can accomplish, and that's what we're hoping to do. So let me just, knowing that we've got only 40 minutes left maybe before we open this up for questions, I want to try to go through this. I think most of you have seen these figures before, and I think most of you who are in this class understand that the gains we've made in this area in terms of life expectancy, which is a pretty good indicator of status within an organization, or within a jurisdiction. The gains we've made are attributable to the type of work we do here in public health. And that's an important lesson for us. And this sort of is what we're left with when we look at the 100 years from 1900 to 2000. The challenges that were addressed in part, and by the way, when you look at this and you think about all the gains we've made, the work that we're doing is no less important. You know, it takes only a breakage of a city water supply line or a major earthquake that knocks out some of our basic systems for conveying wastewater, and bringing in fresh drinking water and not having the two mix. It only takes a major earthquake for all these great systems we have in place and have built over the last 6, 7 decades to remind us how things can go back quickly. A disaster can bring us back and present challenges in many of these same things. So it's not that we ever drop what we're doing, but we have to refocus and embrace yet new challenges, emerging challenges. Okay, so right now these are a little more in line with what public health departments are trying to focus on. This is our current list. And so we've been rethinking within the public health department. A lot of it had to do with the vision that Dr. Fielding had when he was running the organization. But to be fair, public health jurisdictions across the nation have been thinking about this. And I think we needed a few wake-up calls, and we got them at some point. And I think we're all over this now. And we're trying to figure out how do we aggressively respond to these current challenges. And the environmental health programs are doing the same. They were very resistant because they are regulatory agencies at the core. And regulatory agencies are looking for, give me the guidebook, tell me what the regulations are. I'm an inspector, I'll go in and I'll ensure compliance with the regulations. And where I find deficiencies, I will address them. But we have to do more than that. We have to go beyond the enforcement mindset. We have to broaden our view of what environmental health is and how we get the job done. It's not with rules. That's a basis, that's a threshold. And I know many of you know this already. So when we talk about improving health, we generally talk about, we can talk in these general themes: clinical work, behavioral change, and environmental change. And so if we look at how we're going to improve health, where can we focus in each of these areas? And so we do this. And by the way, these slides will be available to anybody who needs them. So I'm going to try to blast through them somewhat. So there's 3 key areas of focus that we have now, and I like to think of these 3 areas as being where we can talk about the problems that are emerging and also the solutions. They can be broadly grouped under these 3 major themes: preparedness, sustainability, and healthy communities. So I'm going to go through some of the emerging areas, and then I'm going to spend the balance of the time on some recent work we've done where Dr. Jared has been involved, and he's involved a few of the students as well on this work that we've done together. But on the preparedness end, climate change, adapting to climate change, which is occurring at a rapid rate, that is certainly a major part of what we have to do under the theme of preparedness. Preparing for natural and technological disasters is a reality as well. And I think we have had some ability to do that over the years with natural disasters like earthquakes. Even an interruption in our water supply gets us to do more in terms of contingency planning. And then acts of terrorism. We have been receiving preparedness funding for many years now following 9/11, and we've tried to utilize that to the fullest extent. So it was allocated in response to terrorism, but the little secret that we all have is that we prepare now not just for acts of terrorism, we do what we're calling preparing for all hazards, and it's amazing. It's basically the same. So we can justify the expenditure of those funds year after year, and there's $15 million in these grants that we get from the federal government, and we utilize that to fuel a lot of the work that we're doing, and it goes way beyond preparedness, as some of you may have already learned. Sustainability, there's the mitigation end of addressing the climate change, mitigating our greenhouse gas emissions. By the way, just a quick note on, well, no, I'll do that in a minute. Integrated water management. We have such a major challenge with water that we have to think of new ways in which to ensure we have a safe and steady, sustainable supply of water into the future. And then the work that we're doing on sustainable communities, there he is. I say sustainable communities and he walks right in. How you doing, Dick?
Sorry.
So the work that Dick has done, and I've got all the books that he's just piled there on the desk there. It's been landmarked, as many of you already know, and it's an important part. So even in a local environmental health jurisdictions, the health inspectors that are out checking the food and checking the housing and checking the landfills, we're expanding into other areas, and that's one where we're asking, what can we do? How can we partner with others in the public health department to find our role there? And that's an important part of it as well. So then part of healthy communities also is not just ensuring that we have safe food, we've got to have healthy food, right? So there's a statement that I've used before saying that we could line the streets of LA with McDonald's and we could ensure a pretty safe food supply. The question though is, how healthy is that for our population? And so we have to not only protect the public from the dangers of food infectious diseases or communicable diseases, foodborne illness, we also have to make sure that they have access to healthy foods, because both of them can end up killing them. Only slower with regard to unhealthy foods. And then design, again, another area that Dr. Jackson has been a leader in the nation. And then toxic risk reduction, and I will be devoting a lot of this lecture to that. So let me just move ahead then. So on climate change, there's two pieces to this. There's reducing the greenhouse gas emissions themselves, and then there's the preparedness, and we have to constantly be working. What we've done in the local health department is ask, what is the role of local environmental health on each of these? And we've put out a couple of documents that I would urge you to read. They're on our website that defines what the role of a local public health agency is. I won't spend time talking about it here, but we were flailing. We were lost for many years. We wanted to do something in this area, but we weren't quite sure what it was, and we came up with a 5-point plan that defines what those responsibilities are. And believe me, there's plenty for us to do in this area. One of the things that we learned in this area as well, and Dick could also speak to much of this, and a lot of what I've learned in this area came from Dick, but we have to make sure that we're, as a public health agency, we have to be heard on this issue. Because when I first entered the fray here on climate change, what I noticed is that when we went to conferences, they were run by resources people at the State Resources Agency, or by air quality people. Because after all, we were looking at greenhouse gases. But I went to one of the first sessions, Dick, I think you presented at it in Sacramento. This was maybe 9 years ago, 10 years ago. And it was trying to get public health officials together to find out where our play is in this and how important is it that we engage in this. And I think the one thing that we've all learned is that this motivates a lot of people to act with regard to the climate threat. But, but this does it even better when we can put the public health perspective on what this means to our population. So I think that's where we've seen some real traction on climate change and some real interest is we're putting it in terms that the general public can get behind, everyone can get behind. So we're talking really about the impacts it has on people. And then on integrated water management, again, it's about using our water efficiently, but more than, and protecting our water, continuing to protect our water. But more than anything, it's really about how do we expand the various uses of water, because we only have a finite amount of it. So the question is, what can we do to capture water when it falls out of the sky, not let it travel to the ocean 25, 30, 40 miles and pick up all the contaminants and then create a discharge problem, but rather collect it and get it to infiltrate to recharge our groundwater supplies before it becomes contaminated, before it moves too far along on the urban landscape. And how do we take and recycle water, industrial wastewater, but other waters as well that are generated? How do we do that? And we're starting to see some real reforms in that area as well. Of course, it's beyond, just like the food area, it's beyond protecting our water supply from contaminants. It's about securing an adequate water supply, adequate capacity to serve the needs of our public. Access to healthy foods, again, we've talked a little bit about this. We have to support innovation in this area. I remember one of the state legislators, Mike Gatto, who was sponsoring a bill on cottage food industry. At the health department, the locals, even our statewide organization, their immediate response was, are you kidding me? We're going to let people prepare food in their home kitchens? A home kitchen? They don't have commercial equipment. It's not going to be easily cleaned. And this is a little easier for those of you that are here to embrace. You're younger. You're not saddled with all the ideas that many of us who've done regulation for most of our life are saddled with, which is that there's the right way to do things and that you don't stray too much from that right way because somebody could get sick. And of course, that's the way dinosaurs think. But if we're open to changing and not becoming extinct, we have to really broaden our view of what our roles are. And our role on cottage food was, at the very least, let's be part of this reform so that we don't end up, so we can build in some controls over how it's done.
I wonder if you'd say what cottage food is.
Oh, I'm sorry, excellent point. So if I make granola or I make certain foods at home, I'm prohibited from selling them commercially. I can share them with my friends and my family. I can have people come over and I can prepare anything I want. But if I want to sell that food, it's got to be prepared and come from a lawful source, a permitted source. So it's a restaurant or it's a food manufacturer. Cottage food industry was born out of the concept that certain types of food, if they're not potentially hazardous foods, should be able to be produced in a home environment. So there's a lot of those foods that are considered non-potentially hazardous that are now allowed by state law to be prepared. But our worries were still the same, even though they did not, those food types did not support the rapid and progressive growth of microorganisms. They still could be contaminated with dog hairs and God knows what. We've seen some of the conditions. I see some of the conditions in my son's bedroom that it's scary, let alone what his kitchen would look like. But there was a way in which we partnered, we got our state counterparts throughout all the jurisdictions to say we're going to be part of this bill and we're going to try to make it as good as we can. We're going to build in whatever protection. That's the attitude we've got to have because the trends are changing. The people are demanding certain things right now, and I think we have to find a way to do it without giving up our basic public health protections, but shedding off all the bureaucracy that has us thinking in a very solid state way. We've got to be much more fluid. And this is a good example of that. I'm going to move on. Influencing decisions, just this, I don't know if this is a Dick Jackson slide, but it very well could be. But poor design leads to adverse health outcomes, and here's just a good example of some of them. Again, the evolving role in our environmental health field as it's practiced at the local level, we have to change our mindset. It's not just about protecting people from contact with dirty wastewater or, concerned about if we were ever to let people recreate down here that somebody's going to go in and drink the water. We have to think a little bit differently than that. So whenever we see this, and this happened to be, this is a design for what's being done on the LA River, and we like this concept now. But it takes us asking a bigger question and what do we need to do to protect public health, because that's what we've always asked. We have to find ways in which to create gathering places like this and these healthy environments, because they're healthy in a lot of other ways. We've got to find a way to support them and promote them. So.
Angelo, I was just at a really interesting meeting at Stanford called the Natural Capital Symposium.
Say again?
The Natural Capital Symposium, and there's a tremendous amount of work going on around the world to rejuvenate rivers, but also to turn regular things like street medians into ways of infiltrating stormwater, but they also improve the aesthetics of the local environment, which has been showing us health benefits in itself.
Right, absolutely. And I think that our role historically has been the one that gets in the way of a lot of that progress. And I'm talking about, again, local regulatory agencies, because we don't see the broader view. And because we're working right alongside of our public health partners, we're expanding our view at the local level. Some of you will maybe work past local government. Most of the graduates, we have a steady stream of graduates that come into LA County and work the conventional local environmental health. And it's great background. It's a great background to have. Some of you will bypass it and you'll be working in, you'll be immediately productive in some of the areas, and one of them being the ones we're now talking about. But for those of you that do go into a local regulatory program, learn that skill. It is good and it's always important, but we always have to keep that broader view in mind, because we're not going to regulate our way out of the enormous challenges we have in the country with regard to environmental health. We're going to have to be much more creative and innovative, and we're going to have to learn how to work with our partners. We can be in our silos, or we can decide that there's a whole lot of other sectors beyond the public health sector that influence the health of our communities. And so we've got to be able to expand in those areas. So now I want to do the balance of this before we stop and do some calls on an exciting, important program where the stars were aligned, and as a result, we're utilizing that alignment to develop this in a big way. So, and this is a rediscovery, because when Professor Jackson and I both worked at the California state government in what was in those days the public health department and a division that was devoted to hazardous waste management. We were discovering all these toxic risks in the environment, and Jerry Brown, when we both worked in his first administration, came up with a package of a legislative initiative with 30 proposals that was termed the Toxics Initiative. And that was 83, 80, something like that.
It was thought to be crazy.
What's that?
It was thought to be crazy.
It was thought to be crazy, right. And I wish we could say we did all those reforms. A lot of it was picked up nationally, and the problem was solved within 15, 20 years. But unfortunately, we made some inroads. We made some progress. We established a very good framework, but there's so much more work that has to be done. And I think that what happened is we saw a lot of success, and then we saw people in the agencies themselves just sort of resting and not really pushing the agenda. And so I'm really excited to tell you there's a rediscovery of this, and it's been occurring for some time. And a lot of it has to do with the generation that we were protecting in those days. They got tired of hearing all of the talk and not really seeing much progress. And these issues became less important to many in the generation that was around at that time. So now we have a new generation who's wide-eyed, looking for ways in which to make their lives healthier, and they're asking questions that were asked 40 years ago. And we're now ready to try it again, and we're going to be much more successful this time around. But some recent environmental threats, I'm just going to mention a few of these, because if you guys have questions, we can go into much greater detail. But the Exide Battery Recycling Facility in East LA, it opened up in the 20s. It was one of 2 facilities in the state of California that took batteries and recycled them. It pulled out the components, separated the waste streams, sent some of them off for plastics recycling, some of them to landfill, treated wastewater, discharged it, had a lot of lead that was then placed into burners, furnaces, and was melted and then reconstituted in big lead ingots. Some of them were very heavy, some of them were relatively small. But it did this for decades, and in the process, it wasn't very well regulated. It wasn't well regulated in the old days, say the pre-60s, because there were very few regulations at the time that could adequately control a facility like this. But the real problem here is it was located in proximity to a community. Poor, low-income communities of color, typically, is where we find these facilities that operate at extended periods of time and endanger the adjoining public. But there's some good news there, but we'll take that up on if questions come up. All right. More recently, we had the Fruitland fire. It was a lot of magnesium, tons of magnesium that were stored. Magnesium is a combustible metal. So if it does ignite, the one thing you don't want to do is throw water on it. But, you know, when these substances are in a regulated facility that's very poorly regulated, this is why there was an explosion that night when the fire broke out and the fire department went in unknowing. They put the fire hoses on. Now the dilemma here is that these homes share a property boundary with that facility. And so again, this was another recent incident. Now in the old days, health would say the fire department is responding. Or in really extreme cases, the state DTSC or the federal government is going to respond to this cleanup. We don't do that now. We intervene. We've kind of put a tent around what we believe our role should be in this area, and we're intervening. And we're not a regulatory agency in many ways, but we are the public health department that can provide that public health perspective to make sure this gets done right. It's very similar to what we did in the Porter Ranch area. Speaking of which, okay, so then Alanco Energy, we have a lot, this was a few blocks away from the University of Southern California, but it's an oil production facility. There's no drilling going on. There's some servicing of the drilling wells, or the wells that have been in there for many, many years. But it was mixed in industrial, commercial, residential area, and it made the people living across the street in that housing development sick. And the AQMD's comment to us was, well, we would like your advice on this, but they're not violating any of the standards. And we find a lot of this, which is why we're re-looking at all of the standards. To us, in the old days, we learned about risk assessment. And so when we had an issue like this, the first thing the industry would do is to say, we've checked the chemicals, they're all at concentrations that are of no significance. And yet people in the apartment building across the street are smelling, there's odors that are impacting their health, they're miserable, and you only have to spend 2 or 3 of these to really learn that we've got to go beyond this whole idea of we're going to do a risk assessment to see whether there's a cancer risk or other health impact. You can't pick up some of the damage that is being done to these individuals. Okay, and then Porter Ranch, Aliso Canyon. Is everybody in the room, you've heard of that place, right? Okay, the natural gas release. And then we're currently working one right now. It's a hexavalent chromium in the city of Paramount. It's really important because this is a game changer for us. This is sort of the poster child that, you know, government or public health professionals look for if we're going to try to pivot and make a change. There aren't a lot of known human carcinogens, but hexavalent chromium is one of them. And we're really concerned in this community because the levels of hexavalent chromium were substantially elevated, and unfortunately they were not attributed to a single facility. The regulatory agencies were doing their routine inspections and issuing their notices of violations and working at a pace that was, you know, normal. And then, based on community complaints, there was some monitoring that was actually done on telephone poles. This was our local air quality management district really taking a bold step to move the monitors out of the facility and onto telephone poles and try to get an idea as to whether there's migration coming from the one facility. And what they found was a hot spot that they couldn't automatically attribute to any particular facility. Now, I want you to know first off that with the exception of the criteria air pollutants, we don't really monitor for these toxics on a frequent basis, a regular basis, unless they're being emitted out of a process within a facility. So when we say we regulate these substances, they're usually regulated when they're being used or emitted out of a factory, out of a smokestack or whatever, a water, wastewater line. But in this case, they found a hot spot, and then it was the normal pace suddenly accelerated. And within the last 2 months, we've done a very good job. AQMD brought public health and our other county agencies together and the city of Paramount to do a blitz of the neighborhood and identify how many other potential sources are there. Paramount happens to be one of these areas that has, the city gave us, we thought there were 30 potential sources of hexavalent-chromium. The city of Paramount gave us a list of 80. And so AQMD and the county folks are now going through that list and trying to determine where could all of this be coming from. We're going to change exposures within the city of Paramount, but it's going to require this type of, a great partnership with the community and the agencies talking to one another. And that happens when you find something where nobody doubts that we need to move quickly on this. So we're utilizing it as a good demonstration. Increasing caseload, there's a list of others that we've been working on just in the last maybe 2 to 3 years. Contributing factors, why are these all being discovered now? I mentioned a little bit about, taking a fresh look at this stuff. But a lot of it has to do with the history of land use decisions that put chemical processes or industry in close proximity to people. And we have to be careful where that occurs because we really don't have a buffer. In the old days, we might have looking at monitoring ambient air to determine whether or not we had a problem with air. But if you've got a freeway or an industry and they're right next door to a housing tract, you could have wonderful ambient air, you could be meeting the federal standards, and you could be endangering the health of that adjoining neighborhood because they're living in the shadow of a major source. Insufficient regulatory oversight and enforcement. A lot of times the regulations are really not oriented on protecting health, but on achieving compliance, and often there is a difference between those two. Our regulatory decisions focus on individual facilities and not what's really happening in a community. So if I have a compliant facility here, a compliant facility here, they're all meeting the standards, but I've got 10 of these in a local community, it could be too much for the local community. And that's a paradigm shift in how we look at regulation. But that's where we're headed right now. Aging infrastructure and increased awareness, again, are other factors. That shouldn't be there. Building capacity. So what are we doing to respond effectively to this challenge? Here's our vision. We know these communities that we're focusing in because we're not looking everywhere. We're looking in highly burdened communities. But we're asking ourselves, what should we be trying to do in those communities? Are we going to eliminate all the industry? Are we going to tear down homes? Likely not. So what is our vision? So we want to see that because of changes that are made, people that are living in close proximity to these industries suffer incidents on a much less frequent basis than occurs now. And that when there is an incident, it's not a major unexpected incident because we've done our homework on those facilities and we know what's in them and we can respond effectively. The other part of this is that we're going to change the regulatory model and we're going to ask ourselves, how do we need to reform the way we've been doing things for decades to better protect public health in these areas? Our regulations are going to be strengthened. The facilities are going to comply to a greater degree. Emissions are going to be reduced as a result. And conditions in the environment, you tamp down on emissions and you're going to deal with all emissions. You may be interested in a particular emission, but you're going to be regulating a lot of other, reducing a lot of other substances. And then the groundwork is laid for actual changes in health status that hopefully over time we'll see in these local communities. But that's our sort of guiding vision. And then how we're going to do this within these communities, and we've got 2 pilot communities now, and we'll very likely add the city of Paramount because of the opportunities there. But we're going to increase our own capacity to prevent. I'm talking about us, the county, our member agencies, to prevent these types of incidents from occurring and to effectively respond when they do occur. Secondly, we're going to develop partnerships with the community. We've got wonderful partnerships in the city of Paramount right now and in the community of the Exide community. And we're going to develop similarly wonderful relationships with our agency partners. A lot of them are asking, why is the health department getting involved? What's the jurisdiction? I was on the phone with US EPA regarding an issue in the old Bellomo site near Montrose Chemical. And he was asking us, we heard from a developer who's putting in something that you guys had some questions and you shut down the job. And I go, yeah. And by the way, this was somebody who then proceeded to tell me all about environmental health and how it's regulated. And, you know, I appreciated the lecture, but I didn't need to hear it from them. And, but there's some jealousies among the regulatory agencies. We've got to get by all of that. We've got to work together on these things. I know these are things you folks don't think of much, but you may encounter it when you actually get in the working field. We have to leverage the full authorities. We can't be operating from what we're capable of doing in our organization. If we find something that we don't have the jurisdiction to deal with, we've got to find a regulatory agency that does have that authority. So it's really about combining the authorities, all the authorities that are available to us, and working together. Increased monitoring of environmental conditions and health status so that if there is a change, we can see it. Now this is going to be a big effort, a really big effort. We're going to be working with, you guys as well on this to see what we can do in this area. And then we want to go here. This is another, your school and Dr. Jackson, you guys have been talking about this. So we've got to promote policy changes that influence the way the planning sector, the energy production, the water sector, all of the sectors, the way they operate, transportation. And that's a big order. But within the public health department, we've got what we call a PLACE program. Vic has had a lot of interaction with them. But it's a group of public health professionals, most of which have MPHs, and they are really focused now on how do we influence the decisions of these other sectors. And we start primarily with planning, but we involve a whole lot of other sectors in on our work, and it's working out very well. We're making full use of the available data that's out there. This is one, it's a software program that the state of California has put together. We're based on both environmental factors and population characteristics. They rank now and they give a score, toxic score, to every census tract in the state of California. So these census tracts make up, in this case here, the Florence-Firestone area. And the red here represents that it's in the upper highest 10% most toxic burden census tracts in the state of California. So we're drawing circles around these communities. We did one here, we've done one in East LA, and we're implementing a process that I'm going to just go through here with the balance of these slides. Information is everything, so this was excited. Things that we did 25, 30 years ago, sometimes they're very useful. We passed a law called AB 2588 where we were requiring facilities 25, 30 years ago to produce risk assessments when they were handling certain chemicals and they were not meeting the discharge requirements. And this was one that was produced for the Exide facility, which is right here in the city of Vernon. And these are just contours, and this last contour is really not that relevant, but it is their modeling. This was done by their consultants that said you don't get to less than 1 × 10⁻⁶, 1 in a million excess cancer risk level until you go as far north as Altadena or as far south as the Pacific Ocean. And that, with this figure here that encompassed 105,000 people in East LA, that's what got things moving at Exide. People were complaining about Exide for many, many years. So getting information and putting it in the fashion that the public can use to advocate for their own improved conditions is also a very important part. I don't know why this slide is here, but that was the point. And then I'm going to skip by these, but we do find that this information is very useful to present to people. Here we see hospitalizations per 10,000 people. In the Florence-Firestone area, that boundary I showed you, it's 25 per 10,000. LA County's average is 10.3, and you get an even broader range if you look at the various communities in LA. And we can use this type of data as well. Here's elevated blood leads, and this is a percent of children less than 6 years old with blood leads above 4.5 micrograms per deciliter. And the LA County average here, 1.9% of the population for the testing that's done and within Florence Firestone it's 5%. But these differences are really important, and they're empowering to the communities that live in these areas. I had said earlier, when you look at these figures, this is another one that's been very useful. But if you look at the county average, 80.3, and I think this is 2006 data. You look at a Westmont area, as in East LA, it's 72, and in La Cañada, it happens to be 88. So look at the differences in life expectancy. I think I've heard you say many times that, or it was Tony Iton, but you made reference to, tell me where you live and we can tell you how healthy you are. But it does have a lot to do with geographic factors. And well-being is something we've got to focus on. I'm going to conclude right now only because, well, let me just say this. We put all of these facilities within that boundary, and we rank them, and we also have the community tell us, are there things we're missing? Because a lot of times we don't have an inventory. They have knowledge about facilities that are operating underneath the permitting. And with all of that, we reorient the regulatory agencies, we bring these facilities into compliance, and we work together with our community. But I wanted to at least mention that as well. Are there any questions? I'm sorry I spoke so long here and didn't leave much time for questions, but we have time for a couple of minutes, I think. Yes.
Could you talk a little bit about how you ranked the businesses and what data you were using?
Right. We asked the regulatory agencies, we said, look, we want you to tell us about facilities that have been in substantial non-compliance based on their last 3 inspections. And so we let the regulatory agencies decide what their criteria was. We said, we're not worried about paperwork violations. We want to know, are they discharging in excess? We gave them guidance and they gave us the information back. That was part of it. And then their compliance history was also. So it's compliance history and the type of, we didn't even consider facilities that weren't handling toxics. And we didn't look at any industries that were outside of the focus area, which was very close to people.
I just wondered for the students, if you could share your perspective on what the most important aspects of being an environmental health leader are. Because you certainly are, an amazing environmental health leader for the county. We're looking at how you, if you had to distill it into important characteristics that they might think about as they're going to do it.
Right. Thanks, Michael. And the simplest way I can say this is, don't identify with your place of employment. I've worked in many different areas. Our identification should be with our profession. And you'll always be in this profession. You'll leave one job, go to another, eventually you'll retire, but you'll never leave the profession. So it's that commitment to public health protection that I think is an important part of what we do. And then it allows us to find the opportunities wherever we're working and work within the constraints of that workplace to dial forward. And that's the shortest answer to that. Yes, Dick?
I just want to say this. Michael just said it, I'm going to reinforce it. This is a very rare bird we have in front of this room. I would say about 1 in 100 environmental health, county environmental health leaders understand the importance to linking to health. This is going to become profoundly